Okay, good afternoon, everyone. We are sorry for the technical difficulties, but we're getting ready to start this webinar. This is the successful collaborations between child support and TANF programs, and we have our moderator, Carol Mizuguchi. There will be a Q&A session. You can put your question and answer into the box in the lower right-hand corner, and they will be answered at the end of the webinar. Now go ahead and turn it over to Carol.
Good afternoon, and thanks for joining today's webinar. And I would also like to just apologize for the delay and thank everyone for their patience. Today, the webinar on successful collaborations between child support and TANF programs. We're very, very happy to have a wonderful slate of expert presenters to discuss this important topic with you today. This webinar offers us an opportunity to share promising practices around strategies for successfully collaborating between child support and TANF programs in order to operationalize collaborations within states and provide more integrated, holistic support for low-income families. The benefits of such interagency collaboration include increased reliable child support payments among unemployed or underemployed non-custodial parents, coordinated services to help non-custodial parents overcome employment barriers, enhanced child and family well-being, better use of scarce resources, and decreased public costs. Child support and TANF programs share many of the same clients, specifically those who are unemployed, underemployed, and have barriers to employment. In this webinar, state programs will share processes for establishing and maintaining effective collaborations with key partners, enhance services to incentivize participation and completion, recruitment and retention strategies, and other lessons learned. Our learning objectives for today include understand benefits of the interagency collaborations between child support and TANF programs, identify support available to create and maintain child support TANF interagency collaboration, describe ways to initiate and operationalize these interagency collaborations, and then finally list strategies to encourage engagement, family stability, employment, and retention. We're very fortunate to have dynamic speakers who will be guiding our conversation today about successful collaborations between child support and TANF programs. Throughout the presentation, you will have an opportunity to ask questions through the chat box in the bottom left corner of your screen. We encourage you to actively participate and ask questions during the town hall segment of this webinar. And if your question is for a specific presenter or program, please be sure to specify that. If we do not get around to everyone's questions, we will provide Q&A that will appear on the PeerTA website, along with the transcript and audio recording of today's webinar. During the webinars, there will also be a series of polling questions that will appear on your screen. Please answer each by clicking on the radio button next to your selected response. Doing so will not only help us guide the discussion, but it will also share additional information that may inform your practice. We will first hear from Chris Traver. Chris is the Acting Director for the Division of Data and Improvement in the Office of Planning, Research, and Evaluation with the U.S. Department of Health and Human Services Administration for Children and Families. Mr. Traver serves as the Acting Director, and he manages a dedicated team of subject matter experts spanning a number of unique initiatives with the common goal of improving the collection, management, sharing, and analysis of data programs. He is also responsible for an agency-wide interoperability initiative to build integrated human services systems that are capable of robust data sharing, support increased collaboration, and facilitate harmonized policies and processes. Other proposals expand the adoption of the National Information Exchange model and fostering multidisciplinary information exchange with health, justice, education, and other stakeholders to enable coordinated service delivery and improve the efficiency and effectiveness of human services programs. After we hear from Mr. Traver, we will hear from Babs Roberts, who currently serves as the Director for the Community Services Division with the Economic Services Administration of the Washington State Department of Social and Health Services. Babs has been the Director since December of 2009. CSD has the primary responsibility for the policy development and implementation of public assistance programs such as TANF, refugee cash assistance, the aged, blind, disabled, and pregnant women's assistance, as well as the supplemental nutrition assistance programs, commonly known as basic foods, and food assistance programs for legal immigrants. In addition, CSD provides eligibility determination services for a multitude of medical assistance programs and child care subsidies. CSD works in partnership with Employment Security, State Board for Community and Technical Colleges, the Department of Commerce, the Department of Early Learning, and Office of Financial Management to implement the workforce programs, which provides employment and training assistance to TANF recipients that are designed to move parents towards self-sufficiency through employment. And finally, we will hear from Amy Burgon, who serves as the training coordinator for child support services at the Kansas Department for Children and Families. Amy began her service to Kansas child support in 1991 in clerical, and after a short time, she became a caseworker. She continued in that position until 2005, when she became a trainer and a quality assurance specialist in the Performance Improvement Division for the Kansas City metro region. In August 2010, she joined the administration as part of the Self-Assessment Training Unit. Amy is currently the training coordinator for Kansas's Child Support Service Program, and she oversees the Child Support Savings Initiative Program, Self-Assessment Unit, and the Kansas Child Support Call Center. Okay, so now we will have our first polling question. How would you describe your state's current collaboration between the child support and TANF programs in providing effective and timely services for shared clients? So it looks like the majority of the folks on the phone have described their current collaborations as fair. We have a couple that we also have good. So hopefully with the assistance of the information that's going to be shared today, if we were to ask that question later, we would get different responses. So now I thank you for your responses, and I will turn the presentation over to Chris.
Great. Thank you, Carol, and thank you for inviting me to be a part of this webinar today. I want to be sensitive to the fact that we are starting late, and I want to make sure that we leave enough time to hear from our state partners. So I'm going to try to keep this fairly brief. But I do really appreciate the opportunity to speak with you a little bit about what ACF is doing around improving collaboration, and particularly through something called interoperability, which I'll explain in just a second. Okay, so the first thing that I normally have to describe when I present our work is what do we mean by interoperability. In this case, we're here to talk about collaboration between TANF and child support programs. And when you talk about collaboration, what are the mechanisms that we use to collaborate with each other? And obviously the answer to that is there are a variety of ways of doing that. But one of the key things that we want to work on improving within ACF and across human services programs is the ability to share information and data, especially where there are shared individuals and families that are being serviced by multiple programs. So when we say interoperability, what that really means is that's describing the ability of our data systems to communicate with each other to enable the benefits that you see on screen here. Generally speaking, on the left-hand column are the outcomes that we're looking for from individual, child, and family wellness perspectives. And on the right are some of the functional benefits that we want to see from these collaborations through these interoperability efforts. And ultimately, we want to arrive at more evidence-based decisions, the right information at the right place at the right time, and generate those positive outcomes for the people that we serve. So this is our mission statement for the Interoperability Initiative, and for the sake of time, I'll skip over that. So in a nutshell, our initiative supports a variety of different resources. Policies and guidelines are extremely important to enable information sharing implementation. That's what we all rely on to define the parameters with which we are allowed to collect, share, and disseminate information. But these policies are not well factored across organizations. There's not always a direct translation or a direct correlation. So harmonizing those policies and providing consistent guidelines to enable interoperability is critical. On the technology side, there are standards and tools that come into play that enable this to occur, and that's something that we are really focused on right now, and I'll talk a little bit about NIEM, the National Information Exchange Model, a little bit later, which is one of the key resources in this area. We also support field-based pilots, so we try to work as much as possible with our state, local, and tribal counterparts to test out some of the innovative approaches that we're examining and exploring before we take them to scale for broader adoption. And lastly, we always want to keep in mind some of the privacy risks that information sharing and interoperability projects pose, make sure that we're sensitive to those and that we build our systems and information sharing collaborations with the appropriate security and privacy protocols in place to mitigate any risks that come along with that increased sharing. So one of the things that ACF is doing currently to institutionalize this work is they recently created a new division of data and improvement, which is where I work, within the Office of Planning, Research, and Evaluation. This unit will encapsulate ACF's interoperability initiative, which has been ongoing for several years, but has been somewhat up and down in terms of our level of support. So we want to continue the support on an ongoing basis through this new division. But we also want to bring in some of the utilization of the data. So we want to make sure that we have the capacity to analyze, evaluate, and support research with the information that is being shared through these interoperability initiatives. And we'll provide some examples of that in just a moment. Our division also includes some of the work within ACF around the advanced planning document process, which is one of the ways that we receive requests for funding from states for certain technology implementation projects. And we also support programs like PARIS, the Public Assistance Reporting Information System, which I'll speak to a little bit later. So we do have some operational uses of the information as well as supporting state and local adoption. So the initiative in action, in terms of project implementation, that is really where we're focused at this point in time. Our division is brand new. We're just starting to staff up, so we have a limited capacity at the moment. But one of the areas where we are able to provide immediate support is by providing consultation-type services within ACF and to our partners. You could think of that as a technical assistance type of support on a project-by-project basis. We're also trying to reach out to our federal, state, local, and tribal partners across lines of business and across levels of government, obviously, to do a better job of coordinating our approaches to incentivizing and encouraging states to adopt interoperable technology solutions for improved collaboration. One of the ways that we do that is through something we call the Tri-Agency Partnership, which is centered around the idea of integrated eligibility and enrollment systems for some of these various benefits programs, which is one of the things that we work on quite significantly with our partners at CMS and FNS, groups that I'm sure most of you are familiar with. Then we also provide direct support for procurement and software development activities. So again, on the technology side, but one of the things we realized is that when it comes to procuring information systems and the capabilities that go with those systems to help us collaborate with other organizations through data sharing and through other mechanisms, a lot of the people that are engaged in these projects do not have the technology expertise to be able to properly articulate their technical requirements in procurements or deal directly with the software developers to make sure that they get the solutions that they need. So one of the things we're looking to do is provide some of that support layer to help do the translation between the business people who know what they need to get the job done and the technology implementers who can actually make it happen. So that's just some things in a nutshell that we're doing. Some examples of projects. I'm not going to go through all of these in the sake of time, but I thought it was interesting just to point out some of the specific areas that we're active in. I want to mention background checks for child care workers. This is a really interesting project because the Office of Child Care approached us about a requirement to provide background check information for child care offices at the state and local level, based on new legislation that requires them to check certain data sources, including at the FBI and through various state repositories. So this is a very interesting challenge of trying to collect and assemble data from multiple different places, much of which is outside the human services environment. Much of this is criminal justice type data and other types of data, to provide the information required to actually conduct those checks. And as we started looking at this, we realized that it's not just the Office of Child Care that needs this type of support. A lot of our agencies at ACF and their state counterparts need a similar capability to provide background checks, maybe with a slightly different set or combination of information, but yet they still need the process. So is there a way we could help build this in a way that serves the needs of a variety of agencies and not just the Office of Child Care while still meeting their needs? I think this is a good illustration of exactly a type of work on a project basis that our team is working on, and certainly something that we want to continue in the future. And then I just thought I would mention the Public Assistance Reporting Information System, or PARIS. This is looking at benefits programs across the states and across federal benefit programs as well, that includes data from programs including TANF, Medicaid, SNAP, child care, and others. And the purpose is really to detect individuals who are receiving benefits in multiple states. They do this on a quarterly basis, so it's looking after the fact. But it's a great tool in terms of leveraging the information that we all have, but none of us have that direct linkage to each other's systems, especially across state lines, to be able to conduct those kind of searches on an ongoing basis. So we're constantly looking to improve these kinds of capabilities, but this is a fantastic mechanism that combines data from multiple sources on a national basis, and we see this as a model that could be utilized in many other ways as well. So just to mention some of our key resources, NIEM, the National Information Exchange Model, is really the foundation of our interoperability work from a data sharing point of view. Essentially, it provides a data dictionary, which is sort of like a Rosetta Stone for language that allows all of our various systems to communicate regardless of how we structure our data internally, how we use different terminology to refer to the same concepts. This is a means of translating as we're sharing data so that we all have a common understanding to build on. So that's a really important tool that we want to promote adoption across human services. Then we have something called the National Human Services Interoperability Architecture, or NISIA. And this was something that was built about 5 or so years ago. This is before my time. But I think it's a wonderful resource. And essentially, it is a planning resource for technology implementers, especially architects and planners, who are trying to map out how do all these systems connect? How do our programs interact with each other? How do the data systems that each of those programs use are able to interface with each other. This is really a great planning tool that can help you develop a roadmap toward interoperable solutions, and that is going to enable stronger collaboration between your programs. So if you're inclined, this is a fantastic tool that I would definitely encourage everyone to take a look at. And then just to round it out, our Confidentiality Toolkit is a wonderful resource that deals with the various privacy and confidentiality issues related to the specific data sets that each of our programs interact with. And it's divided up by program area. So depending on which program you're working on or where your organization is housed within the state, you can go to that specific section and identify what are the key laws, regulations, policies that I need to be aware of that are going to influence my ability to collaborate and share data across and outside my organization. So that's a great tool. And then cost allocation methodology is about the funding process, so I won't get into that too much right now. So then lastly, I just wanted to provide, sorry about that. I wanted to provide a sampling of what some of our strategic objectives are moving forward. I want to point out that the products and resources that I've referenced so far are available today on the ACF interoperability website. The link was on a slide a couple slides back, and I hope these will be available to you so you can find that. But some of what I'm talking about is also very aspirational. So it has been several years since ACF has really invested significantly in our interoperability work. And so this is a great opportunity with the creation of this Division of Data and Improvement to really take the next step. And part of that is understanding what your needs are as state and local implementers who want to collaborate, who want a better way of doing business, but aren't necessarily getting the guidance and support that you need from your state and federal partners. We want to understand where your challenges are and understand how we can be of assistance. And I think the last two bullets here are really two of the main keys that we want to strive for. We want to improve the use of administrative and program data to measure and evaluate outcomes. We want to know what works, what doesn't work. We want to know why it works. We want to know in what combination different programs used together can be most successful, et cetera. So we want to really make sure that we're taking advantage of the resources that are at our disposal. And we also want to support integrated service delivery. And as I mentioned, eligibility and enrollment integration is one of our key initial focal points, but that's just the front end of the process. We need to do a lot more in terms of looking at where we have similar or overlapping services that we all need to consume, and really what are the key points where we need to collaborate. At what stage in a case management process do we need information that we're not getting, and where does that information come from, and how can we include that as part of our workflow so that we have better decision-making capability at the right place at the right time. So I think in a nutshell, that's where we really want to go, and I look forward to working with all of you to find out how we can better support your needs. And at this point, I think I will conclude my remarks so you guys can hear from our state experts. So Carol, I think that's back to you.
All right, Chris, thank you. Wow, that's great information. And so I think you had a slide with information sharing the link, and we will have these slides. They'll be available in a couple of weeks on the PRTA website. I know people have asked that question. So now it's time for our second polling question. And the question is, what strategies do your Office of Child Support and your TANF programs currently use? So it looks like the majority of the folks on the phone, so we have comprehensive referrals between programs, which is important, and then the parent education and support. Well, that's a great start. So next we will hear from Babs Roberts from Washington State Department of Social and Human Services.
Thanks, Carol. And thank you for asking me to participate in this. I'm a little bit humbled because I think that there are other states that are doing as much or more, and I always feel like we're just on the cusp of starting something awesome. So, but thanks for letting me participate. And I wanted to talk first about, and I'm advancing my own slides. I just have to figure out how. Oh, there we go. So first I want to talk about why. So when we talk about in Washington, what we started talking about is why would we do this? Why collaborate? Child support collects child support, and traditionally that has been that old mantra that they collect the money and we spend it. But for us, there's a lot of reasons to collaborate. One of the things that is really important is that almost 1 in 3 citizens in this state turns to us, either child support or public assistance, for some sort of assistance, either with cash or food or child support collection or medical. So we take that very seriously. 1 in 3 is a lot of people. In the last few years, in particular in the last few years, our Washington State child support and public assistance programs have really started to partner to connect parents who are facing barriers to paying their child support with services that might lead to helping them meet that responsibility. One of the things we know is that most of the non-custodial parents that are related to a TANF family are very likely facing some of the same or even more barriers that those TANF parents that we're working with are facing. They may have substance abuse or homelessness or chemical dependency or mental health issues that are the same with our TANF parents. And those barriers can get in the way, just as they do with our TANF families, of sustained employment, and sustained employment is necessary to pay child support. So in recognizing that those barriers exist for that population, we really have to do something about helping them to make that critical connection to employment. We also realize that no one division, no one entity is going to be able to do this work alone. If we're truly going to move the needle on self-sufficiency, and if we're really going to end poverty, which is my goal, and I know Wally laughs at me here, but that's okay. If we're really going to end poverty, we have to look at a whole family. We have to look at both parents. We have to in some ways, change our definition of what family looks like, and sort of break that traditional assistance unit mold and really focus on what it's going to take to raise kids in this new post-recession world in a way that's going to allow them to never be our next generation, as well as mitigate the impacts of poverty right now. So, we also recognize that we have some common ground, right? And for our TANF program and our child support program, that common ground is connecting people who are struggling and helping kids have both parents supporting them. Those are fundamental things that we both have in common and we really want to work together on. And that it's a recognition on both sides of the fence that without child support, our child poverty rate would be increasing. It would be higher than it is. So we recognize this as a very intentional, but also a very needed collaboration for the families that we serve. It wouldn't be me if I didn't say it. But so one of the things that I have always struggled with in TANF, I know, silly me, is the idea of this pathway to self-sufficiency. We've talked about a pathway to self-sufficiency in the TANF program and a lot of public assistance programs for a lot of years. And when I get this visual of a pathway, I think about this pretty garden and, the very defined, meandering, sort of easy curves type of pathway that is beautiful. And I'm just going to tell you that I don't think that's the path our clients are on. I think for us in this state, what we've recognized is that for families living in poverty, and in particular in very, very low poverty, we recognize that they're on this sort of super highway with many, many lanes of traffic and expansion joints in which those families often get lost trying to navigate. and often are run over by the very system that is proposing to help them. So for us, this visual document in front of you, this self-sufficiency model, is what we're striving for, is to recognize that they are on our families are on this sort of super highway, and that we as an entity and the system itself, not just the state but DBOs and other partners, really need to work together to help parents navigate through that in order to really see them hit a tipping point where they see real job retention, real career progression, real wage progression that will not only allow them to achieve, but sustain self-sufficiency. So I talk about that whenever I can. So let me get really quickly into some examples of how we collaborate. And I'm going to highlight in particular first the Division of Child Support, which I don't run, but I talk with a lot. And they have some really great innovative programs that they're running and working with us on. So, but the two that I'll talk about their alternative solution program, and then I'll talk a little bit about some of the things we're piloting under our Systems to Family Stability Policy Academy in our pilot sites that we've been lucky enough to be a part of with ACF. So for the Division of Child Support, in developing their program called Alternative Solutions, what they realize is that 50% of their clients are poor or near poor, are very close to the federal poverty level, living under 200% or below 150% of FPL, which is just really, really low income. 15% of their custodial parents are currently on TANF. And it's likely that the non-custodial parents associated with those families are very likely poor or near poor, or are having some of the same barriers as I discussed. We know, and the Division of Child Support has recognized, and they have leadership that is very much aware of this and wants to do something about, that financial support from both parents improves the life outcomes for kids, not just the financial and economic outcomes, but that custodial parents who are contributing to their child's upbringing financially are more likely to contribute to that upbringing emotionally, and be more likely to be a part of those children's lives. And that's just a better situation for all kids. So that's sort of why they started to develop that Alternative Solutions program. But Alternative Solutions is essentially a child support program that reaches out to community-based social service organizations or partners like the TANF food stamp side, who can help the parents that are struggling with their child support. So they created this unit, and they're dedicated to helping parents overcome barriers to child support. And they've developed outreach programs that encourage those parents to request modification of support orders that might be too high, or to find other ways to help those parents. They develop individualized solution plans with those participants, and the plan helps to guide the client by encouraging them to make decisions that will positively impact their lives. And then they also care about, or they also work with our side and other community-based organizations for comprehensive case management. We have a really tight connection right now with child support through this program, where we can use our basic food employment and training dollars to help very low-income non-custodial parents access employment and training opportunities and some case management that might help them overcome barriers. RISE, which is our resources to initiate successful employment, is our SNAP ENT pilot that we're running, which is also focused, as one of the populations, is focused on non-custodial parents with barriers that need more intensive case management, as well as and then work-based learning solutions that could help them. So we're connecting non-custodial parents in that way with SNAP. And then we're just sort of doing forays into developing what we call the employment pipeline, which is a program between across our administration, so includes a high level of focus at the child support as well as the TANF and SNAP side, where we're connecting directly with employers in the community to hire job-ready clients on both sides. So making that more direct connection with local employers, in particular focusing with some employers that are more willing to hire folks with some barriers like criminal history background. So the Alternative Solutions Program will also offer connections to barrier removal services, mental health, and some of those kinds of programs, as well as taking a more trauma-informed approach. So not the traditional collection, but really focusing on what do they need to overcome their barriers. In terms of the Systems to Family Stability Policy Academy work, and this is more focused on the TANF side, we've had over the last year an opportunity to be one of 7 states and 1 county that is really taking a strategic approach to how to change the TANF system in our state. And in particular, what we're wanting to focus on is how do we create a TANF system, and really that would leverage across our public assistance programs that not just helps people achieve, but really helps them sustain long-term self-sufficiency. And through this pilot academy, we've had access to some incredible national expertise, some great research that's being done, some new and emerging best practices that have really helped us to take a more holistic look at how we work with TANF families, including thinking about those families in a more holistic way, including the non-custodial parent, really working with this population to see how can we connect. And in Washington, we requested pilot proposals from not just our local community service offices, our welfare offices, but we asked our Division of Child Support field offices as well to come together and collaborate with us on this. And we've had a couple of pilots. We're testing 16 pilots across 25 offices, but I'm going to highlight 2 that really, I think, give an example of this sort of collaboration. So in our Wenatchee Valley area, we are co-located with our Division of Child Support partners. This pilot really gives a more wraparound service. So they, on the TANF side, we have weekly meetings and case staffings with the family. We take a coaching approach and to this, and we're using the Getting Ahead curriculum, which is part of the Bridges Out of Poverty curriculum, and in developing life skills with these pilots. We connect with the Division of Child Support by inviting that support enforcement officer in that area to come into our initial interview with the parent. And really, it takes a special kind of support enforcement officer to do this well, because what they're doing is connecting with that custodial parent to sort of garner that cooperation piece, having a conversation to talk about not why it's required that they cooperate or that the non-custodial parent pay, but to really talk about the benefits of working together with the parent to help the child grow up, that not just that they're entitled to child support, but this it's not a punitive thing. It's working together. It's how we can begin that conversation about co-parenting. So they're really the support enforcement officer in this area that's doing this work is also a former TANF case manager. So she has both sides of it, and she really has great conversations, and I think they're seeing really good connections with establishing good child support orders early. In our King County area, or North Seattle, which is the biggest area we have, we're piloting a really innovative idea here because this community service office is co-located on a North Seattle Community College campus in what is fondly called the Opportunity Center. So there are community-based organizations, there are employment security officers, there are workforce specialists, and our offices are all housed sort of together in one area and are really able to connect much better with the client. In this office, they're targeting TANF families who cycle on and off TANF, but they hold 2 sets of orientations. They hold one for TANF families, and then in the alternating month, they hold another set of orientations focused at non-custodial parents in the area. And these orientations are really to provide both sets of clients with a more comprehensive understanding of everything we can provide them in terms of employment and training, barrier removal, and other local community resources. So can target both sides of that household in a way that says we are here to help, and let us help you leverage yourself out of poverty. Let us give you an employment and training opportunity. So they've been testing different days, including Saturdays, to see which would be the optimal side. and seeing if that helps us better connect both TANF and non-custodial parents to employment and training opportunities. So that's really the highlights I wanted to make. We're doing a lot around the pilot sites and the systems of family stability. Our child support office has really made significant efforts at working with non-custodial parents through their alternative solutions. And just to throw in the SNAP side, we've really made connections through our SNAP ENT programs. With that, I'll turn it over for questions.
Thank you so much, Babs. I think you're being very modest when you said, there are a lot of people that are doing so much more. Definitely there are folks, other states that have lots going on, but you guys are trailblazers in some respects. So it doesn't look like we have any questions at this time, so we're going to go ahead and hear from Amy and all the wonderful stuff that they're doing. So I'm going to turn it over to Amy. Thanks.
Thank you, Carol, and thank you everyone for being on the call today and allowing me to have this opportunity to present some information about how Kansas Child Support and TANF programs are working together to help better serve our customers here in Kansas. Babs, of course, touched on many of the reasons why collaboration is important between our programs. And, of course, we're all here to help families, and those families' services overlap between child support and the EES, or Economic Employment Services programs we call here in Kansas. Child support in Kansas serves over 140,000 families, and our EES program serves over 5,000 TANF families and over 112,000 SNAP families. And the note on the bottom, on average, child support represents almost 50% of families' income for poor custodial families who receive child support. So increasing those collections is critical for those families to reach any kind of self-sufficiency or financial stability. And we work with our EES partners to try and achieve increasing the income that's going into those families. So these are some of the items we're going to touch on today: our Department for Children and Family structure, the vision, training, the communication between our programs, the way that we receive our referrals from the TANF division, the goals program, which is our version of the ENT, the fatherhood and work programs that we are doing here in Kansas, and joint projects between our child support and TANF programs. Our Department for Children and Families is the umbrella agency over both the child support services and economic and employment services programs. So we all report basically to the same management. The Secretary of the Department for Children and Families is over both of our programs, and any collaboration then is welcomed by her and easier for us to accomplish, since ultimately the decision goes to one person for both of our programs. It's also easier for us to collaborate because we are under the same computer system. We have our Kansas Automated Eligibility and Child Support Enforcement System, and we share client information automatically between our computer systems under a shared client identification, which makes it really easy to get information about customers from one program to the other, such as address changes or income information, phone numbers, things like that, to reach out to customers without having to actually pick up the phone and call or email someone. The information automatically comes across on our computer system. All of our staff are also on the same email system, which makes it really easy to get a hold of people in the other programs or locate those individuals. And we do have some staff, child support staff, that continue to share offices with our TANF program staff. As Babs was saying, that collaboration to have people in-house together really helps with the communication between the programs. Some of our staff for child support, however, are not located within the DCF offices, and that happened a few years ago. And when that changed, we very purposefully set up communication avenues for the TANF staff to continue to be able to reach child support services staff or vice versa in an easy way. to not disrupt the communication or the flow of information between our two programs. This next slide shows the Department for Children and Families' vision and mission. And in Kansas, our mission is to protect children, promote healthy families, and encourage personal responsibility. Again, kind of echoing information that Babs was saying, it really is the whole family that we need to tend to and, alleviate any barriers for that family to reach self-sufficiency or personal responsibility. Another way that we collaborate with Child Support Services in the TANF program is that Child Support Services will assist in training economic and employment services staff. And basically, our overall need of what we need for child support to proceed, and things like explaining, how paternity is established, specific screens that they can view within our system to obtain information on their own instead of having to reach out to a Child Support Services staff person. We work very closely in non-cooperation policy. For example, if Child Support Services needs a specific piece of information or document from the custodial parent in order to move forward with our case, and the custodial parent fails to provide that information, then their benefits could be affected. So we work with the economic and employment services staff to impute those penalties. And then we also provide opportunity for the economic and employment services staff and administration to reach out to us with questions. We even have a specific email box set up that the EES staff know they can send anything to try and get some kind of child support information or provide us with information that we may need to move forward with our case. One example that we've been working on very recently of training that we provide is when not to send referrals to Child Support Services from the Economic and Employment Services side. I spoke a little bit about communication previously, and it's at all levels that we encourage and try to make communication between our programs easier and more efficient. Just, phone or meetings within our regional offices. Our Child Support Services program administrators are involved in meetings with the EES administrators, and even at a level at administration, we try to include each other in meetings for any important topics to be worked out, both, at the state level and regional level. And as I said, we share offices in some of the local offices, but also our administration are together in the same building, which is really great for communication or setting up meetings to address any issues. And I already mentioned we have an email box set up for the staff to contact, and that we're all in the same DCF email, makes it really easy to communicate with one another. The other way that we collaborate well is through our referrals from economic and employment to Child Support Services. We already had voluntary referrals in place for SNAP household, and then made those referrals mandatory. So food assistance recipients are mandatory to cooperate with Child Support Services a little over a year ago. And since we share a computer system, those referrals come across automatically from EES to Child Support Services upon approval of the SNAP benefits or the other mandatory programs, the TANF or child care. There's no easier way that we could receive that information besides an interface between our two programs and it coming across automatically than how we already have it set up. It's great. So I talked about the interface between our systems and how that information comes across, and how if the individual does not cooperate with Child Support Services, the economic and employment services workers will go ahead and apply that non-co-op penalty and advise the individual that they're ineligible for benefits until they remedy that non-cooperation issue with Child Support Services. We have developed a procedure and even a form that the Child Support Services staff fill out in regards to those non-cooperation penalties. We give our customers many opportunities to cooperate before we impose a penalty. We take those penalties very seriously, and we document the attempts to contact the custodial parent on this form before we provide it to the Economic and Employment Services Division, so that if that non-cooperation penalty is appealed in any way, they have documentation available to present at that appeal to show the efforts that Child Support Services made prior to imposing the non-cooperation penalty. As I stated, we made food assistance cases or SNAP cases mandatory a little over a year ago. So from July of 2015, when that first went into place, through June of 2016, we've had over 50,000 SNAP referrals to Child Support Services. Our overall caseload increased by less than 10,000 cases because we already shared so many of those customers. And there's been a little over 2,000 SNAP participants who have received non-cooperation penalties. We also recently initiated a policy to potentially place a non-custodial parent who is receiving SNAP benefits in non-cooperation status. We looked at a lot of different reasons why we might want to a non-custodial parent, and really kind of landed on that, if they aren't providing us with the information that we need to be able to get in contact with them, or reason for non-payment of support, then they can have their SNAP benefits affected as well. So another way that we are collaborating between our programs is the GOALS program, and this is the Kansas ENT program. Child Support Services will assist the GOAL participant customers by reducing their income withholding order for the current child support and arrears payments. We just reduce the arrears portion of that to try to give them an opportunity to have more income coming into their household. We also provide arrears forgiveness opportunities for them completing that program. If there are state arrears owed, then we'll look at forgiving a portion of those state arrears. We're available to answer any questions for those customers, or the GOALS administrators can put the customer in direct contact with Child Support Services Administration to be very readily available to assist them with any child support issues. And the end result is that we're serving these same individuals or clients, and we want to help them better their situation in any way possible. Another project that we work on together is our fatherhood or work programs in Kansas. We have a Work for Success project that started about 5 years ago, and Child Support Services provides incentives to the non-custodial parent fathers who are working with our Connections to Success federal grant. They provide both the fatherhood and work readiness guidance. And then the Department for Children and Families wanted to replicate that Connections to Success project throughout the state, so it was further extended in 2016. It's TANF funded and Child Support Services managed. And one example of a collaboration with those Work for Success vendors is that Child Support Services in Kansas has a child support savings initiative program that has to do with 5 to 9 college savings accounts. And there's a $25 minimum deposit required when a non-custodial parent opens the account. So our Work for Success vendors are paying that $25 initial deposit for non-custodial parents upon graduation from their program. And any child then will get a 5 to 9 account opened for them and for non-custodial parents who completed the program. A couple of other joint projects that Child Support Services and TANF programs are working on are the fingerprint background checks, some Department of Revenue information, for example, driver's license pictures and information we're working on together. I mentioned the Fatherhood and Work for Success and the GOALS program. And then we also work on some BetaGov research data projects. For example, one right now for text messages to customers, reminding them of their appointments and keeping track of whether that's increasing the customers who show up for their appointments or not. Another local example that's not listed here of collaboration between our two programs, here in Topeka, our state capital, we have a monthly integrated service team staffing at our Topeka homeless shelter. So people from each one of our programs, child support, economic, even our prevention and protection services division, meet with customers that are identified by the homeless shelter as needing, some kind of assistance from the Department for Children and Families, and wrap our services around that individual and their family to assist them in any way with whatever issues they're having to become successful. So that's some quick information about how we collaborate here in Kansas. This last slide has both my contact information and then our Employment and Security Administration contact, Chris Tomlinson. So if there are any questions about what we're doing here in Kansas, please feel free to reach out to either one of us. Thank you very much for your time.
Amy, thank you for that presentation. And just I would like to move on to our final polling question. Just what is the likelihood your child support and TANF programs will enhance collaboration within the next 6 months using at least one of the new strategies that you've heard about? Okay, so it looks like we have 25% of folks saying very likely, and then 33 somewhat likely, and a couple that haven't really decided yet. So thank you very much for answering those questions. And again, I would like to just say thank you to all of the presenters with a wealth of information. And at this time, we're going to open it up for questions from the participants. And it looks like we have a number of questions, and I'll turn it over to Jennifer.
Carol, our first question is, are the 25 local offices tribal TANF offices?
So I think that's referring, this is Babs, I think that's referring to my presentation. The 25 offices are state-run welfare offices. The tribal TANF programs are independent sovereign, so not tribal TANF.
Thank you. Our second question is, what is the number of TANF families per career specialist in total numbers?
In Washington right now, we're running on average about 1 to 50.
Our next one is
our total caseload is right around 30,000.
Wow.
That would include child-only cases, though.
Our next question is, any success stories with the pilot project?
Oh, yes. So we're 1 year into the pilot projects, really 1 year into the pilot, and the Policy Academy about 6 months, 7 months into actual implementation across most of the pilot offices. Mostly what we have right now is anecdotal information. Each of the pilots that are running, however, do have an evaluation component. They have a set of metrics and goals that they wanted to reach and outcomes that they wanted to reach that are part of their sort of roadmap. We're giving them about 3 more months to really ramp up and get to a point where there's good data around that. So what I have right now is mostly anecdotal. And in that anecdotal information, in terms of the pilot academy, what TANF families are responding to really well is the pilots where we're focusing on more intensive case management in a more coaching methodology, a more coaching style, where there's an emphasis on both. Yes, there is a participation requirement, and we do need them to participate, but there's more intentionality on our case manager side to get to what is really going to be beneficial for families, in particular in these offices. So that sort of shift in how we work with clients has really been very positive. I've had a couple of letters directly from clients that have just expressed how much they really appreciate that more intensive look. In particular, related to child support, though, in our Spokane office, they're running a pilot that is focused at cohorts of young parents, so parents more likely in that 16 to 24-year-old range, more likely to have very, very young children, and bringing them together for 12 weeks of work together where they define what it is they want to learn more about. And one of the things that comes up repeatedly in those cohorts is this misperception that young parents, especially first-time parents, have, where they're not living with the non-custodial parent, where they believe because they have physical custody of their child, that gives them legal custody of their child. And so they haven't sought out a parenting plan or any of the first steps that would really stop some of the conflict. And so we're working through some of that with those families.
And the next question is kind of on that same line is, how are you tracking the success of these pilot programs?
Yeah, mostly through, specifically we set up coding in our case management system so that we could track the families in each of the pilot offices, and so we'd know whether they were part of the pilot or not, and we'll be tracking their outcomes, both early indicator outcomes, so are they engaging more, are they less likely to go into sanction, and are we hitting their barriers earlier, but then long term, we'll be tracking whether they stop cycling, are we seeing more engagement in our infant exemption population, or some of those metrics. But it's very early still, and I don't have that data yet.
Okay. Our next question are any of the state TANF programs working with tribal child support programs?
Tribal child support program. Huh.
This is Amy in Kansas, and yes, we are working with a couple of the tribes here in Kansas on a regular basis and have basically collaboration between our programs. For example, we'll set up kind of a limited services case for the tribal program for federal debt set-off. That's just an example of one way. Or we have one tribe that we work with to give credit and intercept their per cap payments to credit toward the arrears that go to the custodial parent.
I would say in Washington, I haven't gotten that far yet.
Our next question is, what is SNAP?
So SNAP is the Supplemental Nutrition Assistance Program. It's what food stamps, it's food stamps, but with a new name.
Our next question is, how do states manage confidentiality requirements for each program? Do each department program just have clients sign a release and that covers the sharing of information?
So in Washington, I would say we have in our TANF program, and I don't know how we manage this because we've been doing it for a long time, but we have the ability to at least check a read-only of our child support system. So our TANF case managers already have the ability to look into that system and to check on whether there's child support ordered or not. Beyond that, I don't know. I'd have to do some checking. I just know we have the data. So.
And in Kansas, part of the application for assistance states to the customer that any information provided could be shared with other programs under the DCF umbrella. And then as far as, access between staff of the information, and we all sign the same confidentiality requirements. And on the child support services side, we take IRS regulations into consideration and limit the information that other staff can see within our system to make sure that no FTI information is being viewed by any other program.
Okay. And the next question is, what are the EES penalties?
They're different for TANF and child care versus SNAP or food assistance. The TANF and child care penalties are a tiered approach here in Kansas. So with the first penalty, the customer is ineligible for 3 months and then has to reapply. The second penalty is 6 months. The third penalty is a year. And then the fourth penalty would be 10 years. And then for food assistance, it's handled differently. The penalty is applied to the case head or the primary individual, and basically their portion of the food assistance is reduced based on that child support penalty until they cooperate.
Our next question, do you require cooperation with child support for customers when only child care services are being received?
Yes, here in Kansas, we do require cooperation for only child care recipients.
Next question, what are the incentives for the fatherhood/work program?
Kansas Child Support Services has a number of incentives for state-owed arrears. Specific to the Workforce Success or Connections to Success courses, Child Support Services gives an adjustment of like $50 an hour for the first 15 hours and then $25 an hour for a max of $2,000 off the state-owed arrears. But we also have incentive programs. If a noncustodial parent completes a GED or high school diploma, they can get $1,000 adjustment toward their state arrears. Or if they have a tech ed or vocational training, it goes up to $1,500 off their state arrears, and a college degree is $2,000 off their state arrears. And then we also have a Child Support Savings Initiative or 529 College Savings Program that provides some incentives both for state-owed arrears and custodial arrears.
Another question is, can you provide more information on the fingerprint background check?
Right now, the Kansas Department for Children and Families is working with KDAD, another group who has gotten a grant from the feds on doing fingerprint background checks. And since child support is going to need it by September of 2017, we're working closely with them as well as our Kansas KBI, Bureau of Investigation, to get that up and going.
I would also add that on the federal side, I have been working with the Office of Child Care, and they're developing a portal to facilitate the sharing of some of this information. And I saw a couple people ask about more details on that. So if there are any states that are interested in getting in touch with the Office of Child Care and talking through what they're doing and whether there might be any impacts there, I'd be happy to put you guys in touch. So if you could just send me an email, we can follow up after the webinar.
Thank you, Chris. So this question is for Bab. They wanted to ask you what kind of attendance the pilot sites are seeing in their orientations with NCPs and training/employment programs. Mm-hmm. And they say it sounds like you're doing an awesome work.
That's sweet. In the pilot site where we're doing that, initially we were seeing very low numbers, 1, maybe 5 individuals. In changing the day away from a Saturday and into the week, we're seeing a few more numbers come in. I haven't checked recently, but in one of the issues that they're exploring in their intervention is which days of the week would be better. What we found on both the TANF and the non-custodial parent side is that Saturdays don't seem to work for anyone except us. So during the week we get much better numbers, but still, I would say probably in the lower 10, maybe 15.
Awesome. And then this next question is also for you. Can you explain the trauma-informed approach with the Alternative Solutions Program?
So, and I'm going to speak very generally about it, but in terms of trauma-informed approach, what we're usually referring to there is a more informed approach about what it's like to live in poverty. So having some clear understanding of what are the potential barriers that people in poverty are facing, a clearer understanding of, and maybe even a more compassionate understanding of the choices that people in poverty have learned to make, the skills that they've developed in lieu of executive functioning skills that they've developed. And really it gets down to the heart of, you know, when you haven't grown up in poverty and you haven't really had to live with that scarcity, you don't always understand why people make the choices they make. It doesn't seem to be the intelligent choice, but if you understand that people living in poverty, especially intergenerational poverty, are very likely don't have the executive functioning skills to do long-term intelligent goal setting and planning, then it becomes a little bit easier to understand why they make the choices they make and to help the client understand how not to do that.
Great. This next question is for Amy. Can you give a little bit more detail about how Kansas is able to forgive a portion of state arrears?
Yes. So when a custodial parent applies for our services, then they give an assignment of support rights, and any arrears that are due to the state are then due to our Secretary for the Department of Children and Families, and we just have in our regulations that our secretary has the power or ability to remove any arrears that are owed to the state.
Okay. The next question is, does anyone do referrals from their child care department?
Yes, Kansas does referrals that go from, we have a separate system that houses our child care cases, and that system communicates with our child support system just as the food assistance or TANF one does, and we receive automated referrals from our child care division.
Our next question is for Kansas. What waivers were needed to allow mandatory CS referrals for SNAP?
It's a SNAP state option that we took advantage of.
Okay. And our final question we have here is, please elaborate on the reduction of CP's arrears with Kansas Fatherhood/Work program. Does CP have to agree to the program in order for NCP to participate?
Sorry, I touched on multiple arrears incentives programs when I was talking about our fatherhood arrears. The participation in the work programs or fatherhood courses just have to do with state owed arrears being forgiven. And I touched briefly on another incentive program that we have that's called a Child Support Savings Initiative program. Totally separate program from work programs or the courses or even the completion of GED that I mentioned. The Child Support Savings Initiative program, we have a grant from the Kellogg Foundation that allows us to be able to match a deposit into a 529 account as a collection to the custodial parent. So the amount paid or the amount due to a custodial parent isn't affected on their side.
Great. So I just want to thank everyone who participated in today's webinar and to say thanks again to our expert presenters. For those of you on the line, please remember to provide your feedback on this webinar using the survey that will appear in a separate pop-up window when the webinar ends. As a reminder, a transcript and audio recording of this webinar will be available shortly on the PeerTA Network website, which is at acf.hhs.gov. We would also like to hear from you about future webinar topics, so please send us your ideas by email to peerta@icfi.com. And as always, we hope to expand our network, and so we ask that you would please share with your colleagues from your local and state networks and agencies, and direct them to the website, which again is prta.acf.hhs.gov. And we look forward to your participation on future webinars. So thank you.